The next set of questions and questionnaires and tools that we're looking at are screening for distress tools. And there's been a lot of work, particularly in the cancer world, around talking about this as the sixth vital sign. So you can just see this thermometer. Usually these are graded on a 0 to 10 scale, being 0 no distress and 10 extreme distress. And distress can happen in a psychological way, emotional, social, and or spiritual nature, or it could be physical. But it's kind of an anxiety or distress that's related to what's going on and interfering with the ability to cope effectively with the disease, its symptoms, and its treatment. And significant levels of distress are experienced by at least 35 to 40%. So when they looked at sort of about 50% answered in the 0 to 3, about 30% in the 4 to 7 range, and about 20% in the 8 to 10 range. And certainly, you know, even if you're not sure that this person's pain is 10 or 12 out of 10, if they're saying that it's 10 or 12 out of 10, it's communicating that there's a significant level of distress that may need to be diffused. So screening for distress, this is a tool that's used in most cancer settings across the country, and the layout of the tool may vary a little bit, but usually it's a combination of the ESAS-R, which looks at symptoms, and the Canadian Problem Checklist, and then maybe one or two other tools, and we'll talk about what we do in British Columbia. And in some of the early work that was done to validate this tool, they found that it made conversations more focused. You were able to provide support directly towards the issues that people were experiencing, and people experienced the conversations as being more meaningful because it actually identified their concerns and began to address them. It does slightly increase the time. In British Columbia, our form also has a body map on it. It has one question about quality of life. How would you perceive your quality of life, which shows you kind of what's the gap between their expectations and their reality and how they're living into that. So here's the Canadian Problem Checklist. Now, in a way, how we use this at the Cancer Agency is people are given these forms in the waiting room, and they fill them out before they see us. There are some people who struggle with filling out forms. There's been lots of research done. Patients actually don't mind filling out these forms if we're going to do something about what they've written down. If they fill it out and we never look at it, then they don't want to fill it out. But if they're going to fill it out and then we're going to use it to frame our conversation, they're more than willing to do that. So there are 24 items, and they kind of cover all the commonest domains. And 50% of people will identify fears or worries. Another third of patients will identify issues with their understanding of illness, where am I at, what's going to happen, sleep disturbances, feeling like a burden, family and friends, worried about family and friends are present in about a third of our patients. So again, that can just help you focus the conversation. And often if they're worried about a family member or a caregiver, then have that conversation with the caregiver separate from the patient, just so they can be completely honest and transparent about some of the issues they may be experiencing. About 25% will experience anger or sadness, issues that they just feeling frustrated with what's happening, the multiple appointments, the fact that it's not working. And again, just surfacing those in an empathic manner can just help diffuse some of that for our patients, and or they might need treatment for anxiety or depression. In this last week in my clinic, I had a lady who checked 3 out of 10 for depression and anxiety, but 14 out of 24 boxes were checked. So it triggered a whole other conversation. I'm not going to be the one specifically to deal with issues around each of these things, but I triggered a referral to patient family counseling, to a social work supporter, so that she could have a place to talk about that. She needed help with talking with her healthcare team because she was on 8th line chemo, had lived with her breast cancer for over 12 years, but was now seeing a decline. Her family were not really aware of what was going on, and busy husband, child at school, far away, not present, and she was just starting to wonder, how is this going to go? I'm all alone at home and I'm not coping. And so now a family meeting could be arranged, and we could start to talk about what was actually going on for her and how to make her family more aware and bring them into her care. So you can see how this might help you to just kind of structure the conversations and to know where to go in terms of making decisions about care. This is the ESAS-R. And so these are the commonest symptoms. Some people think constipation should have been added because it's not there. So sometimes there are other things you want to flag depending on what kind of issues people have had. But basically, 0 being no pain or nausea or whatever, and 10 being the worst possible pain. And that's kind of the end of our presentation. So hopefully throughout our presentation, you've heard how a good assessment, which includes using some of these tools in a physical exam, can enable patient and family-centered outcomes by asking more questions than we might usually do about what's going on for them and what some of their concerns may be. I often say to patients my goal is to help you live as well as you can for as long as you can. So I need to know about the things that are interfering with the quality of your life. My goal is to reduce the impact of this illness on you. By talking about things ahead of time, it helps to provide a roadmap. People can anticipate decisions, and they can anticipate, we might need to get a hospital bed in now. We need to put bars on the toilet now, and we can start to guide decision making. At what point would you no longer want to continue on this path, and you might want to change your goals? Lessens distress and symptom burden and supports improved functional status, and certainly can help us know who else needs to be involved in order to provide the best care possible for our patients. Thank you.